Good morning everyone, I am Relvance Listan and today is another day of learning. And we'll be tackling about the process and the most common hazards in a prenatal development. So, let's keep on learning. Prenatal development involves in three main stages. These are the germinal, embryonic, and fetal. Common hazards include exposure to teratogens. These are the substances that can cause birth defects, maternal health issues, and genetic factors. Teratogens like alcohol, tobacco can cause medications and pose risk. The intended learning outcomes for this lesson is to understand the sequence stages of prenatal development, explain the significance of each developmental stage, emphasize the impact of prenatal factor on future health and well-being, foster awareness about the role of genetics and environmental issues, and the teratology, how does drugs and alcohol can adversely affect fetal development, inadequate material nutrition that can lead to developmental issues, the certain infections that if contracted during pregnancy can harm the fetus, maternal diseases, maternal stress, and exposure to pollutants. And how do we cope up with these hazards? It is to promote awareness of prenatal risk and encourage informed choices, ensure consistent medical checkups for early detection and intervention, encourage mothers to adopt a balanced diet, and avoid harmful substances, provide support and resources for managing maternal stress, and lastly, promote a safe and clean living environment for expectant mothers. Now, we are going to talk about the different stages of prenatal development, and that would be discussed by my groupmate, Miss Julie Ann Layag.
Prenatal development. Prenatal development starts with fertilization in the germinal stage of embryonic development and continues in fetal development until birth. In human pregnancy, prenatal development is also called antenatal development. The development of the human embryo follows fertilization and continues as fetal development. Prenatal development occurs in three main stages. First, germinal stage, weeks 1 to 2. Fertilization of the egg by sperm forms a zygote. Rapid cell division occurs as the zygote travels down the fallopian tube and implants into the uterine wall. Second is embryonic stage, weeks 3 to 8. Major organs and structures develop. The embryo is particularly vulnerable during this stage, and exposure to harmful substances can lead to birth defects.
And last is fetal stage, weeks 9 to 40. Organs continue to develop and grow. The fetus becomes more active and by the end of the stage is capable of survival outside the womb. True full-term birth is optimal. So each stage is critical for development aspects of development, and disruptions during these periods can have lasting effects on the individual. Emphasize the impact of prenatal factors on future health and well-being. Prenatal factors significantly influence future health and well-being. Exposure to substances like tobacco, alcohol, or certain drugs during pregnancy can lead to developmental issues, birth defects, or long-term health challenges for the child. Adequate nutrition and prenatal care are crucial as defenses or complications can affect physical and cognitive development. Additionally, environmental factors, maternal stress, and genetics play roles in shaping a child's future health. Investing in a healthy prenatal environment lays the foundation for a child's overall well-being and reduces the risk of various health issues later in life. Foster awareness about the role of genetics and environmental influences. Understanding the interplay between genetics and the environment is crucial. Genetics provide a blueprint, but environmental factors shape outcomes. Promoting awareness fosters informed decision-making and underscores the importance of both influences in various aspects of life.
And now, we are going to talk about what are the different common hazards in a prenatal development. The common hazards on prenatal development. The several hazards can impact prenatal development. It includes exposure to drugs, alcohol, infections, and environmental toxins. Maternal stress, malnutrition, and certain medical conditions can also pose risk. It's crucial for expectant mothers to receive proper prenatal care and avoid substances that can negatively affect the developing. So what are teratogens? Teratogens are substances that cause congenital disorders in developing embryo or fetus. A teratogen is anything a person is exposed to or ingests during pregnancy that's known to cause fetal abnormalities. Drugs, medicines, chemical, or certain infections and toxic substances are examples of teratogens. Teratogen can also increase the risk for miscarriage, preterm labor, or the following determines how dangerous teratogen exposure is during pregnancy. The drug substance or type of toxin, how long is pregnant person was exposed, the amount of exposure or dosage or quantity, the gestational age of the fetus or weeks of pregnancy at exposure, and lastly, the hereditary factors that could increase the fetus risk. Alcohol, cigarettes, and recreational drugs. Alcohol, cigarettes, and recreational drugs. For alcohol affects the fetus central nervous system. Drinking alcohol during pregnancy increases the fetus risk of fetal alcoholic syndrome. Fetal alcohol syndrome is a disorder that can cause abnormal facial features, a small head and brain, and other physical and behavioral disabilities. There's no amount of alcohol intake that's considered safe during pregnancy. Cigarette smoking. Cigarette smoking is associated with fetal growth restriction, premature birth, and miscarriage. Smoking also affects the fetus' sensitive lung, tissue, and brain. Using substances such as cocaine, methamphetamines, heroin, marijuana during pregnancy can also cause low birth weight, heart problems, and neonatal abstinence syndrome. This is when a baby goes through drug withdrawal after birth. Sharing needles can also cause infection. About 5% of people use these substances during pregnancy. Poor nutrition can also cause a hazard in a prenatal development because as soon as conception occurs, the rapidly developing embryo uses the mother's nutrient stores to support its growth. If there are not adequate stores of nutrients including micronutrients like zinc and iron to meet the high metabolic demands of early pregnancy, fetal growth and organ development will be compromised. So how does poor nutrition affect development? A gestational diet poor in nutrients can lead to maternal and fetal malnourishment, which can be observed from birth until infancy and can result in premature birth with gestational ages below 37 weeks, low birth weight, and babies that are small for gestational age or SGA. Children who do not receive sufficient nutrition are at high risk or exhibiting impaired cognitive skills. STI or sexually transmitted infections during prenatal development can have serious consequences for both the developing fetus and the pregnant individual. Certain STIs such as syphilis and HIV can be transmitted from the mother to the baby during pregnancy, childhood, or breastfeeding. This transmission can lead to complications such as congenital disabilities, developmental issues, or even life-threatening infections. Maternal illness or maternal diseases, birth defect prevention for expecting parents. Maternal illness increases the chance that your baby will be born with a birth defect or have a chronic health problem. Diabetes, cytomegalovirus, toxoplasmosis, and strep B are just a few of the illnesses that can cause an adverse outcome to pregnancy. Maternal stress can also give a big impact in prenatal development. During prenatal development, a mother's stress can potentially impact the developing fetus. High levels of stress may contribute to an increased risk of preterm birth or low birth weight. Additionally, maternal stress hormones can cross the placenta and affect the developing fetal brain, potentially influencing later emotional and cognitive development. The last hazard in the prenatal development is the environmental toxins. Exposure to environmental toxins during prenatal development can pose risk to the developing fetus. Substances like lead, mercury, and certain pesticides can negatively impact neurological development, potentially leading to cognitive and behavioral issues. Pregnant individuals should avoid such toxins and consult healthcare professionals for guidance or minimizing risk.
Now, how do we cope up with these hazards? That would be discussed by Mr. John Benedict Liguan.
Coping with hazards, education and awareness. We know that not birth defects can be prevented, but we also know that women can increase their chances of having a healthy baby by managing health conditions and adopting healthy behaviors before becoming pregnant. Having a healthy pregnancy is one of the best ways to promote a healthy birth. Getting early and regular prenatal care improves the chances of a healthy pregnancy. Regular prenatal care. A woman should be sure to see her doctors when planning a pregnancy and start prenatal care as soon as she thinks that she is pregnant. It is important to see the doctor regularly throughout pregnancy, so a woman should keep all her prenatal care appointments.
Regular prenatal care title. A woman should be sure to see her doctor when planning a pregnancy and start prenatal care as soon as she thinks that she is pregnant. It is important to see the doctor regularly throughout pregnancy, so a woman should keep all her prenatal care appointments.
Healthy lifestyle choices. Healthy eating is always important, but especially when you're pregnant. So make sure your calories came from nutritious foods that will boost your baby's growth and development, such as lean meats, fruits, vegetables, whole grain breads, low-fat dairy product, and such. Eating a healthy, balanced diet helps you get the nutrients you needed. And also, it is strictly advisable to avoid harmful substances like smoking, drinking alcohol, or use drugs, as it puts pregnancy at risk. Stress management. As women embarks on their journey as mothers, They experience a multitude of changes both physically and mentally. Unfortunately, a significant number of women experience maternal health issues. There are various types of treatment that women can seek out, and this includes therapy, medication, support groups, and etc. With proper treatment and support, women can overcome maternal mental health issues and continue to thrive as moms. Environmental precautions. Exposure to toxic substances in the environment and working in unsafe areas can affect the development of your baby and have a lifelong impacts on their health. When planning for pregnancy, it is very important to create an environment for you and your growing baby to be safe and healthy.
That's all for today. Thank you for listening. Bye!